everyone, this is Art Therapy for Healing Stress and Trauma. Have you ever listened to music so profound that it moved you to tears? Stood in front of a work of art and felt your breath catch in your chest? Art and music have an incredible ability to unlock emotions in an audience and have the same power to open the door to our emotions through the creative process. Art elicits a wide range of emotions and can transport us in time and space. It inspires empathy and reflection. What is art therapy? Art therapy is a mental health profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience with a psychotherapeutic relationship. From the American Art Therapy Association, 2022. So you might ask, why choose art therapy? Art therapy is a tool that allows people to relax enough to get in touch with their feelings. It can get past the clutter and the chaos that's making us feel stuck. Creating art helps patients' stress levels drop so they're able to focus on processing emotions and working on emotional release. Art therapy removes the pressure for perfection and allows people to just be in a state of creative flow. And you don't have to be an artist, so there's no pressure to perform or create something perfect for others to see. It's a process that's designed just for the person creating the art in therapy. Some of the benefits of art therapy: stress reduction, improved focus, lowered cortisol levels, self-expression, improved self-confidence, lowered pain levels, builds self-awareness practices, fosters a sense of accomplishment, instills a sense of pride, and aids in understanding emotions and their causes. Our brain can't focus on two separate things at the same time. So if we're actively engaged in creating, we're not ruminating about stressful events or the things that we're anxious about. It gives our brain a break from all the other things that are constantly going on in our minds. So, in looking at who can benefit from art therapy and why, I read a really interesting article by a therapist, Natasha Green. She explained that for many of her BIPOC clients, they've expressed that art therapy is a less intrusive introduction to the therapeutic process. Art therapy doesn't carry some of the same stigmas that traditional talk therapy still does. And she explained that the Black community specifically is still struggling to overcome the detrimental stigmas of mental health care. And art therapy is a less threatening path to access the care and the support that they need. Art therapy can be a really effective means for building rapport with clients as well, who may have issues surrounding trust or who may have medical traumas. Collective art therapy and collaborative or supported individual projects can help build relationships and create connection. So many people struggle with the stress and anxiety of forming relationships, and taking these thoughts out of creating provides it natural moments to connect. They can access this deeper level of connection through just mindfully focusing on the creative process and building something unique that represents how they feel. Vulnerable and marginalized populations can be particularly receptive to art therapy and can gain tremendous benefits. Kids can also really benefit from an artistic approach to therapy because it's less intimidating, and most kids love creating art anyway. So it's a familiar process and provides a distraction while they're discussing and working through some really difficult topics. Art therapy for trauma. Art therapy in conjunction with cognitive processing therapy, or CPT, was found to improve trauma processing, and veterans considered it to be an important part of their treatment as it provided healthy distancing, enhanced trauma recall, and increased access to emotions. Campbell, Decker, Kruk, and Deaver in a 2016 article. So here's some ways to create art in therapy. Just about any medium can be used for art therapy, including unconventional options like tree branches or twigs or rocks. Some options include painting, drawing, ceramics, fabrics, sculpting, coloring books, doodling, textiles, which is a mixed use of fabrics or crochet or knitting, scribbling, making art journals, and doodling in journals with colored pencils or markers or watercolors, collages, and even doing different forms of photography. Art therapists practice in a variety of settings to meet the needs of clients. These include hospitals, schools, veterans clinics, private practice, rehab facilities, psychiatric facilities, community clinics, crisis centers, forensic institutions, and senior communities. You'll often see art therapists working in assisted living centers or long-term care centers to give people a break and a different approach to medicine and healing. So, how does art therapy actually work? Through integrative methods, art therapy engages the mind, body, and spirit in ways that are distinct from verbal articulation alone. Kinesthetic, sensory, perceptual, and symbolic opportunities invite alternative modes of receptive and expressive communication, which can circumvent the limitations of language. Visual and symbolic expression gives voice to experience and empowers individual, communal, and societal transformation. That's from the American Art Therapy Association as well. It's extremely effective in people that have verbal communication problems, especially like people on the autism spectrum, as well as people with learning disabilities or cognitive disabilities, as it helps them just look at their emotions differently and access parts of their brain and parts of their emotions and expressions that they might not be able to just trying to explain how they feel. Creativity in and of itself is important for remaining healthy, remaining connected to yourself, and connected to the world. Art therapists aren't just regular counselors who pull out some pens or paper or paint supplies. There's an actual process. So, what is that process? Start by earning a bachelor's degree. Not required for all paths, but a bachelor's degree in a relevant field like art, psychology, or counseling is usually a good start. Graduate from a master's program in art therapy. This is the primary requirement for becoming an art therapist. Art therapy master's programs typically combine art focused coursework with psychology and clinical training. The alternative option is to get a master's degree in therapy of some sort or in social work, and then do a postmaster's certificate in art therapy. Then complete supervised clinical experience. This includes both practicum, smaller supervised experiences, and internship, longer, more in-depth experience hours. Supervision is crucial to ensure you're developing the necessary skills. Apply for provisional registration, ATRP, once you have your master's degree and are working under the supervision of a qualified supervisor. You can apply for the provisional registered art therapist credential. This is a stepping stone to becoming a registered art therapist, which is the next step, applying for the ATR status. After accumulating the necessary supervised experience hours, which depend state to state, they're different, then you can apply for the ATCB or ATR status. And then you can go one step further to become board certified to get an ATR BC. And that requires passing the ATCB's national certification exam, which allows you to achieve the highest level of recognition. That's that ATR BC. It's not mandatory, but it can enhance your credibility and marketability. And then some states require additional licensure, but this process is the general format for becoming an art therapist. So you can see that there's a lot of additional requirements, and it can give you the security in knowing that if you seek out an art therapist, they've gone through the training and they know what they're doing. And it's also a path that a lot of therapists are choosing to go into now. And it's a goal of mine, actually. After I get my master's degree, I'm hoping to get certified in art therapy. Art therapy can be a really great option for people who may not have had great success in traditional therapy formats. And it helps us get outside of our comfort zone and outside of our expectations of what a therapy session is, so that we can tap into the root causes of what's behind our stress and trauma and process them in a way that is less intimidating while we're focused and in a flow state of creativity and art. Like, it can also be really effective when art therapists add music into other forms of creativity and creation. And it can be a really useful tool for a lot of people that are just kind of stuck and need help and want to try something different. So thanks so much for watching, everyone. Take care. And here's my references. I used some references from the American Art Therapy Association, as well as the American Congress of Rehabilitation Medicine.